Welcome to the Entry-Level Competencies for Licensed Practical Nurses in Canada online learning module. You may find it beneficial to have the accompanying ELCS for LPN's 2019 document for reference as you review this module. This module, like the ELC document, describes the entry-level competencies expected of the LPN in Canada. Entry-level LPNs are at the point of initial registration or licensure following graduation from an approved practical nursing education program. In this module, we will review the Nova Scotia College of Nursing mandate, definition and purpose of entry-level competencies, also called ELCs, key revision process for the ELCs, key aspects for the 2019 edition, assumptions, what's new, ELC categories, new competencies, and wrap up the module with the conclusion slide. The Nova Scotia College of Nursing mandate is to serve and protect the public interest, preserve the integrity of the nursing profession, maintain public confidence in the ability of the nursing profession to regulate itself, and to set and monitor standards for the profession. There are approximately 15,000 nurses registered with NSCN that provide nursing services to Nova Scotians. This includes LPNs, RNs, and NPs. An ELC is an observable ability of a practical nurse at entry level that integrates the knowledge, skills, judgment, and attitudes required to practice safe, competent, and ethical nursing care. Entry-level LPNs are beginning practitioners whose level of practice, autonomy, and proficiency will be enhanced through reflective practice, evidence-informed knowledge, collaboration, mentoring, and support from colleagues. ELCs are those competencies which an LPN can be expected to perform at the time of initial licensure. Once licensed, LPNs are expected to be able to demonstrate all ELCs throughout their career as guided by the specific context of their role or position. Through formalized and informal ongoing education and practice experience, LPNs expand their knowledge base and competence. ELCs are used by LPN regulators and other stakeholders for a number of purposes, including practical nursing education program approval and recognition, development of standards, practice assessment and measurement of initial applicants and current registrants, professional conduct review, competency-based assessments, curriculum and exam development, practice consultation, stakeholder information, a resource for employers about the awareness of the practice expectations of the entry-level licensed practical nurse, and promotion of public awareness regarding LPN practice expectations. The revision of the ELCs was commissioned by the Canadian Council of Practical Nurse Regulators, CCPNR. To ensure its relevance and currency, this document is revised every 5 years, with the last update occurring in 2013 and the latest version in 2019. A cross-jurisdictional process was used to enhance consistency, to recognize the ability for LPNs to move across the country as required by national laws such as the Canadian Free Trade Agreement, and to enable timely jurisdictional reviews of entry-level competencies. This process included consultation, development, and refinement phases, with the consultation phase consisting of focus groups, an environmental scan, and literature review. CCPNR approved the ELCs in the spring of 2019. However, there were a number of processes that needed to be in place prior to their use, including notification of schools of nursing, register and awareness, addition to PN curriculum, and CPNRE, including the revisions in the exam. As a result, the ELCs came into effect in January 2022 for Nova Scotia. Key aspects for the 2019 ELCs that were identified by the subject matter expert group for consideration during the development of each competency for this revised version includes a number of items. The first is a new name. The ELCs were officially renamed entry-level competencies to align with the language used by registered nurses, nurse practitioners, and registered psychiatric nurses. Previously, they were known as entry to practice competencies. Assessment for consistency and congruency was important, so that each competency was considered individually and in the context of the other competencies across the nursing profession for its ability to be relevant on its own. Maximum clarity and minimum redundancy were also important and part of the revision process. Each competency was reviewed with an editor's lens to ensure it was as clear as possible. Some competencies remain unchanged from 2013, and some were streamlined, which resulted in a reduction of the number of competencies in the 2019 version. Broad construction. The competencies are broadly constructed so they may apply to every LPN in every context, and their relevance will endure in an ever-changing healthcare sector. The concepts were modernized, and this goes hand in hand with maximum clarity. Some competencies were revised by removing the dual action, such as recognize and report, and replaced simply with report, given that recognition is required, or takes action. For example, recognizes and reports unsafe care has been modernized to takes action if care is unsafe. This is paraphrasing, but provides the meaning I am speaking of. Non-clinical. There are no clinical-based competencies. However, there are some references to clinical situations in the preamble that describe each group of competencies within the framework. And finally, validation benchmarks. Having a validation process is an important component in the development of new documents, and in the ELC validation, it was evident that engagement was strong due to the large number of responses that were received. Notably, the quality and quantity of validation survey responses exceeded the benchmark average nationally and in Nova Scotia. Over these next 3 slides, we will review the assumptions that are understood to apply to the practice of practical nursing in Canada and to the ELCs that follow. The foundation of practical nursing is defined by entry-level competencies, professional nursing standards of practice of the regulatory authority, nursing codes of ethics or ethical standards, scope of nursing practice applicable in the jurisdiction, and provincial, territorial, and federal legislation and regulations. Assumptions for an entry-level LPN include practices built upon the 4 concepts of person, environment, health, and nursing. Practices grounded within the context of the current Canadian healthcare system, primary healthcare, and emerging health trends. Possesses competencies that are transferable across all areas of responsibility. Is an active participant in health promotion, illness prevention, and harm reduction activities. Practice in any setting or circumstance where healthcare is delivered. And requisite skills and abilities are required to attain the LPN ELCs. In this 3rd slide on assumptions, we will conclude with the assumptions for an entry-level LPN, and these include entry-level LPNs practice autonomously, safely, competently, and ethically along the continuum of care in situations of health and illness across a client's lifespan. They practice in situations of varying complexity and works collaboratively with the healthcare team to maximize client outcomes. They demonstrate leadership by fostering continued self-growth to meet the challenges of an evolving healthcare system, by following a systematic approach by using the nursing process to deliver safe, competent, and ethical care, and advocates for the implementation and utilization of evidence-informed practice. Over the next few slides, we will look at what's new in the 2019 ELCs. As we have been discussing assumptions, you can see they underpin all the ELCs. The assumptions were formerly known as the Principles of Practical Nursing Practice in the 2013 document. In this revision, there was the opportunity to decrease repetition and provide clarity in each competency as much as possible. Like the predecessor, the assumptions apply to practical nursing and all other competencies. In addition to the assumptions being clear, there are now standalone statements. The organizing framework has not been changed and remains aligned with the exam blueprint. However, in the 2013 version statements, they were under a specific stem or heading, and in the 2019 version, each competency is a standalone statement organized under the description of the grouping. Standalone is best practice, allowing the competency to be clear and not result in duplication. Throughout the course of the revision process, it was apparent that a number of the competencies were applicable and could be refined to reflect our current healthcare landscape. 90% of the competencies came forward from the 2013 version. 75% of these were updated for clarity, grammar modernization, or to reflect the current practice context. Before we review the new competencies, let's look at an overview of the 76 entry-level competencies that are organized in 5 categories. These 5 categories include professional practice, ethical practice, legal practice, foundations of practice, and collaborative practice. The professional practice competency includes 19 competencies. The overview for this competency specifically states, LPNs adhere to practice standards and an ethical framework. They are responsible and accountable for safe, competent, and ethical nursing practice. They are expected to demonstrate professional conduct as reflected through personal attitudes, beliefs, opinions, and actions. Licensed practical nurses focus on personal and professional growth. LPNs are expected to utilize knowledge, critical thinking, critical inquiry, and research to build an evidence-informed practice. The ethical practice competency includes 9 competencies. The overview for this competency specifically states licensed practical nurses use ethical frameworks, such as the Code of Ethics and ethical standards, when making professional judgments and practice decisions. They engage in critical thinking and critical inquiry to inform decision making and use self-reflection to understand the impact of personal values, beliefs, and assumptions in the provision of care. The legal practice competency includes 8 competencies. The overview for this competency specifically states licensed practical nurses adhere to applicable provincial, territorial, and federal legislation and regulations, professional standards, and employer policies that direct practice. They engage in professional regulation by enhancing their competence, promoting safe practice, and maintaining their fitness to practice. Licensed practical nurses recognize that safe nursing practice includes knowledge of relevant laws and legal boundaries within which the licensed practical nurse must practice. The Foundations of Practice competency includes 25 competencies. The overview for this competency specifically states licensed practical nurses use critical thinking, reflection, and evidence integration to assess clients, plan care, implement interventions, and evaluate outcomes and processes. Foundational knowledge including nursing theory, health sciences, humanities, pharmacology, and ethics. The 5th category, collaborative practice, includes 16 competencies. The overview for this competency specifically states licensed practical nurses work collaboratively with clients and other members of the healthcare team. They recognize that collaborative practice is guided by shared values and accountability, a common purpose or care outcome, mutual respect, and effective communication. Now that we have taken an overview of the 5 categories and the competencies, let's talk about the brand new competencies. These 7 new competencies are dispersed across the organizing framework, as you can see here on this slide, and were added due to feedback from subject matter experts, stakeholder groups, or validation survey that indicated there was a gap in the knowledge of the beginning practitioner. Over the next 5 slides, we will review these new entry-level competencies. Starting with the professional practice competency, number 19 has been added. This competency distinguishes between the mandates of regulatory bodies, professional associations, and unions. It is important to understand that regulatory bodies' mandate is public protection, professional associations promote those in the profession, and unions advance issues for the nurses in the practice environment. The new addition to the ethical practice competency is number 24. This reflects changes in our response to the calls to action. Nurses obtain the competency and respond to the calls to action of the Truth and Reconciliation Commission of Canada. This competency is identical to the RN ELC. Number 31 is new in the legal practice competency and highlights the role of the duty to report. Nurses have the competency to adhere to the duty to report. This is similar to other nursing designation ELCs. These next 2 new competencies, number 57 and 58 in the Foundations of Practice competency, are related to critical thinking and strategizing in challenging environments. Number 57 is intended to prepare LPNs to critically think when all things are not equal. High-risk practice is not about referring the client to the RN when caring for unstable clients, but situations where LPNs need to think critically to figure out what strategies need to be put in place to ensure the complicated intervention at hand is performed safely. Number 58 is intended to prepare LPNs to learn to apply strategies to prevent, de-escalate, and manage disruptive, aggressive, or violent behavior. The final 2 new competencies, number 66 and 67, are within the collaborative practice category. Number 66 is intended to help the LPN understand their scope of practice in relation to their own capacity and employment setting. And number 67 is intended to help the LPN understand where they fit in their own professional nursing role and within the interprofessional role. In conclusion, the ELCs describe the integrated knowledge, skills, and judgment expected and required of PN students upon graduation. The assumptions are shorter and clearer. Each competency is a standalone statement organized under the description of the grouping of the framework. Language has been updated for clarity, grammar modernization, and to reflect a more relevant and timely context. And the 7 new competencies have been added. These include 1 in the professional, ethical, and legal practice, and 2 in foundational knowledge and collaborative practice. Thank you for participating in this entry-level Competencies for Licensed Practical Nurses in Canada online learning module as we discuss the revisions that included the addition of 7 new competencies. At the back of the ELC document, there's a glossary and terms of reference that may be of value if you're in search of more in-depth definitions and further reading. We encourage you to reach out to the practice team should you have any questions, and you can reach them by contacting practice@nscn.ca.